Hi there, and welcome to the first Journal Club or presentation from the Clinical AI Academy. My name is Ahad Nazal, and we're going to present today a preprint with the title Guidelines and Standard Frameworks for Artificial Intelligence in Medicine, a Systematic Review. Before we do that, I would like to go through some organizatory stuff. So, as I said, this is the Clinical AI Academy, and this will be the first Journal Club. Today is Monday, October the 6th, 2025. So the whole idea of Clinical AI Academy is to try and improve AI literacy in healthcare, and trying to do that by providing high quality, open source, educational, transdisciplinary content focused on artificial intelligence, neuroscience, medicine, psychology, linguistics, and more. But why use video format? I think this is something interesting to discuss. If you were following my work, I was focusing on LinkedIn, and you might have came across the newsletter we had on LinkedIn, which is AI in Medicine Updates. So you could visit it. And I've been trying to be consistent about it, not that much, but with all what's going on, it was difficult. So the idea is I used to share those updates on LinkedIn, and it was a good way of highlighting new work. But if you're on LinkedIn, you could notice that it is too noisy and no one really has the time to read in depth. And it does not really allow kind of the depth that you would want in a discussion related to such topic. So with this video format, my aim is to kind of slow down in a very fast pace field and focus on a topic or one topic at a time, and then try to learn together. And in this way, I hope that this content would be more accessible to everyone. So if you're coming from whatever background at any level, you're more than welcome here. Medicine, neuroscience, AI, engineering, developing, design, writing, you're more than welcome here. We're focusing on clinical AI, medical AI, but it's a multidisciplinary domain. So I would also want to introduce, before we start with the paper, the page Clinical AI Academy on LinkedIn. So you could follow us there. And also the Notion page, if you have missed it, it has like a lot of resources I talked about in a separate video before. You can check it out. And here we post the recent updates. For example, we have a Substack now. And also, and we have the YouTube channel where you can also follow along, join the discussion. I have posted a couple of videos on it already, so you can join and interact also and learn or join the community. And on the Notion page, wanted to point out that I added also this new source, which is an interesting course from Stanford, a very recent one from 2025. I am watching right now, so I started with the first video, so I will move next videos, and it would be nice to, I added it, so if you want to follow along also, that would be cool. So yeah, that is much, those are the stuff that I wanted to discuss as organizatory things, and we can jump into the paper right now. So the paper title is Guidelines and Standard Frameworks for Artificial Intelligence in Medicine, a Systematic Review. It is a preprint. I'm going to focus on preprints because it's easier to kind of, from a copyright point of view, unless someone who has their paper published in a journal, or if it's open access, then we could present it. If someone has publications and watching this video, please suggest and present your work. You're more than welcome. So this is a preprint. That means it's still going under peer review, but nevertheless, I skimmed through it, and now we're going to go into it together. I think it's valuable to get a little bit of information about the guidelines and standard of frameworks that are there for artificial intelligence in medicine. There are a lot, and we're going to see, and they're important. So this is a kind of an overview topic, not that technical, and it's a good starting point. So let's first start with the abstract. So it starts with a growing volume of evidence marks the potential of artificial intelligence in medicine, in improving diagnostic accuracy, clinical decision support, risk event prediction, drug discovery, and patient management. However, the continuous integration of AI into clinical settings requires the development of up-to-date and robust guidelines and standard frameworks that consider the evolving challenges of AI implementation in medicine. This review evaluates these guidelines' quality and summarizes ethical frameworks, best practices, and recommendations. So this is the methodology section, I guess, what they used. The appraisal of guidelines, research, and evaluation agree the second tool was used to assess the quality of guidelines based on 6 domains: scope and purpose, stakeholder involvement, rigor of development, clarity of presentation, applicability, and editorial independence. The protocol of this review, including the eligibility criteria, the search strategy, data extraction sheet and methods, was published prior to the actual review with International Registered Report Identifier. So they registered their study or pre-registered their study before conducting the review, which is a good practice. So the results. The initial search resulted in around 5,000 studies from 2 databases and 5 studies from manual search. 9 articles were selected for data extraction based on the eligibility criteria. So from the 5,000 studies, they found only 9 articles that fit their eligibility criteria that they have included. So looking at those 9 articles, they say, we found that while guidelines generally excel in scope, purpose, and editorial independence, there is a significant variability in applicability and rigor of guideline development. Well-established initiatives such as Decide AI, Spirit AI, Consort AI have shown high quality, particularly in terms of stakeholder involvement. However, applicability remains a prominent challenge among the guidelines. We conclude that the reproducibility, ethical, and environmental aspects of AI in medicine still need attention from both medical and AI communities. This review emphasizes the crucial need for high-quality guidelines and opens a new venue or opens a new avenue in evaluating guidelines themselves. Our work highlights the need for working toward the development of integrated and comprehensive reporting guidelines that adhere to the principles findability, accessibility, interoperability, and reusability FAIR. So this alignment is essential for fostering a cultural shift towards transparency and open science, which are pivotal milestones for sustainable digital health research. Alright, so there is so much to unpack here. I think we're going to read more about Decide, Spirit AI, and Consort AI. These are all um, guidelines already published for that if someone like developing an AI tool in medicine and they want to report those tools, these guidelines are there kind of to help you report those tools, so that they ensure kind of standard for the publications in clinical AI. So let's look at the FAIR principle first. So Gemini or Google AI is telling us that FAIR in AI refers to designing, developing, and deploying artificial intelligence systems in a way that is free from bias, discrimination, and unfair outcomes, ensuring that everyone, regardless of their background, benefits from AI's advancements. I mean, you could imagine how important that is for in medicine, right? There's this publication, Nature, FAIR for AI, an interdisciplinary and international community building perspective. So this FAIR principles, which are again findable, accessible, interoperable, reusable principles, were proposed in 2016 as prerequisite for proper data management and stewardship, with the goal of enabling the reusability of scholarly data. These principles were also meant to apply to other digital assets. So the FAIR principles are now being adapted in the context of AI models and datasets. Here we present the perspectives, vision, and experience of researchers from different countries, disciplines, and backgrounds who are leading the definition of and adoption of FAIR principles in their communities of practice, and discuss outcomes that may result from pursuing the incentivizing FAIR AI research. All right, difficult word here. So let's look at, so findable, I guess this is easy to understand, but I mean, and then accessible, then interoperable, then reusable AI systems. So if we ask, let's ask, so I just asked ChatGPT to kind of tell us more about that, and how does the FAIR principles relate to AI in medicine. So findable, it mentions that findable, so it's related to data and AI models that are indexed and described with rich metadata, so they can easily be located by humans and machines. Accessible, they are data and models that can be retrieved via standardized open protocols with clear access conditions. Interoperable, data and models use shared standards, vocabs, and formats to enable integration and analysis across systems. And then finally, reusable, data and models that are well documented, licensed, and formatted to allow future use and validation in different contexts. Interesting. So yeah, that's the FAIR stuff for you. And so again, FAIR stands for findability, accessibility, interoperability, and reusability. Okay, so right, they found 9 articles. Let's look at the Prisma figure. So they conduct also like risk bias assessment, and they use the agree-to tool. The agree-to tool for measuring or the quality of the studies. And so the Agree To tool contains 23 items. So it's like a checklist from 23 items on a scale, Likert scale, from 1 strongly disagree to 7 strongly agree. So from 1 to 7, and grouped within 6 domains. So the domains that they used to do their quality assessment was scope and purpose, to assess whether the guideline stated the main target and scope of the intended use of the guideline. Domain 2, stakeholder involvement, assess whether the guideline development process incorporated a representative view of relevant stakeholders, including users. Domain 3, rigor of development, evaluates the methodological thoroughness followed during the guideline development process. Domain 4, clarity of presentation, assess the clarity of format and language conveyed in the proposed guideline. Domain 5, applicability, assess the presentation of facilitators and barriers to implement these guidelines. And Domain 6, editorial independence, assess the statement with respect to funding bias and competing interest. Then overall assessment, this domain reflects the subjective assessment of evaluators regarding the overall quality of the guideline and their opinion in recommending the use. And I think I've read somewhere that they asked 2 reviewers to go through the studies and do the appraisal, if I'm not mistaken. Right. I will leave the link to the study in the comments, and then you can also look more details if I missed it. Look it up. Right. Okay, that's the risk of bias evaluation, and here are the results. So let's see how they got their final 9 studies out of 5,000 studies. So they started at the identification stage. They went to PubMed and found 2,510 studies, and then went to Web of Science and found 2,465 studies. They removed the duplicates, and they identified from other websites 5 studies, websites and citation researching. So then so they got rid of the duplicates, then got the records for screening. So the screening is looking at the title and abstract. So records excluded were 2,455 studies excluded after looking at the title and the abstract. Some studies even didn't have an abstract, so they excluded them, and records removed after full text screening, so were 1,585 studies. So after looking at the titles, the abstract, and then looking at a little bit at this text, they screening the text, they ended up with 268 studies for retrieval. So they get the full text. They did not manage to get 2 reports or 2 studies. So the final reports assessed for eligibility were 266. So then they looked in more details, more than the screening, and they excluded non-guidelines. Around 100 studies were non-guidelines, 145 studies were out of scope, and 16 were limited to 1 medical domain, so they excluded that also. All right. So, and after including the studies from different resources, they ended up then and excluding from here also out of scope or 1 medical domain. So from the different resources, they included 2 studies, and then from here they excluded 100, 245, so they ended up with 9 studies. So, right, lot of exclusion went in here. I didn't get the one medical domain thing. Why would they exclude that? Probably they mentioned it in the methods. So they mentioned the eligibility criteria, but I don't think they mentioned the exclusion criteria. Yeah, maybe if they're watching this video, they could include that somewhere, or maybe I have missed it. Anyhow, so they ended up with 9 studies. We don't know exactly what was the exclusion. I think they maybe because they mentioned it here, they don't describe it. So yeah, that's the 2 reviewers independently conducted the full text. And okay. No, they don't mention why it was one domain. Maybe it's self-explanatory, but I don't understand it. Okay, so those are the 9 guidelines that they found. They are summarized in Table 1, characteristics of the selected reporting guidelines of AI-related studies in medicine. The Tripod guideline, the Spirit AI, the MG guideline, the Consort AI, the GDRML guideline, STARD guideline, Decide AI, MI claim, and then clear. And in the table they have such like a summary, and we can see each guideline, I think, what domain. So for example, let's look at the outcome for each guideline first. So the Tripod has an outcome of checklist of 22 items. Spirit AI has Spirit 2013 items plus 15 checklist items. MG has like a checklist of 8 core items with 33 sub-items and free text items. The Consort AI has Consort plus 14 items, new items. So this is from the Lancet. And the GDRML has 12 checklist items. The STARD has 30 checklist items. Decide AI has 27 checklist items, 17 AI specific and 10 generic. The MI claim has 21 checklist items. The clear has 58 checklist items. And right, I think it would have been good to kind of include the number where the corresponds to the reference, so we can go and find it, like something like here. Maybe it would have been interesting to include, so we can go back to it and look at it. So the Tripod is standard followed ES guidance for developers of health research reporting guidelines. They included here. No, not always. Okay. The Spirit AI, so it followed a standard, which is the Equator Networks methodological framework. The MG did not follow a standard, but used a stepwise approach. The Consort AI followed the Equator standard. GDRML did not follow standard and it did not report how they built the checklist. The starred, not reported, but documented in the Equator network. Decide AI followed the Equator network's methodological framework. The MI claim not reported, the clear not reported. So they followed most of them followed like the Equator network methodological framework, which is find it here. So yeah, that's the Equator network, and I think you can, for example, look guidelines, and see what's gonna come up. So you can see the names here: consort, starred, etc. Is it working? I don't know. So right, let's say your medical education. If you're reporting the abstract or if you're reporting a data, and it gives you like which framework that you can follow. I think this is helpful if you're publishing your AI research to be familiar with. So the Equator network, you can find more about it on the equatornetwork.org. Right, so let's go back. Right, so this is table 1. So those are the summaries of the 9 tools that they found. And then they mentioned the domain of each of those guidelines. So the tripod, the diagnostic or prognostic prediction model reporting. And then the Spirit AI reporting of AI trial protocols. And so if you have an AI trial, clinical trial, you could refer to the Spirit AI on how to publish it. Sometimes the journals ask you to stick to a specific guideline for reporting if you're developing AI tools. MG reporting linked data. Then reporting clinical trials, you could use the Consort AI. If you're developing a machine learning tool, you could use the GDRML. Start reporting of diagnostic accuracy studies. So if you're predictive model, if you're developing a predictive model, maybe you go to the tripod. Diagnostic, you may go to the decide or to start or tripod. And radiomic studies, for example, clear. Here reporting best practice for MI claim, reporting best practice checklist for minimum information about AI modeling. So if you're about modeling, I mean, when you're publishing, maybe it's worth to look at the journal and see which guideline they recommend that you follow for your specific AI tool. Right. So they focus from this agree to domain, they focus on 3 main domains, which is the rigor of guideline development, stakeholder involvement, and applicability. So domain 3, 2, and 5. All right, our results show that the aggregate scores of scope and purpose domain 1 from 68 to 93. So, right, domain 6, which is editorial independence, from 75 to 97. And The aggregated scaled results of identified guidelines across agreed to domains is shown in figure 2, from high percentage value green to low percentage value red. Let's see if we can decipher that. So the summary here, if I understood it correctly, green is highly, so green is good, so it's in like high results or high score based on their criteria of assessment. Red is bad. So these are the 6 domains for the agreed to domain. That's a heat map of aggregate scale of agreed to scores among guidelines with respect to domains. So that's the guideline, that's the agreed to domain, scope and purpose. So most of them did a good job. The best one was clear and decide, right? So clear and decide from the guidelines on the domain of scope and purpose did a great job. Stakeholder involvement, so if they are involving people who are going to use the AI tool in their, or like experts or users in the development of the guideline. So the best one was Decide AI and the worst one was MG. Okay, so the third domain is rigor of development. I think this is one of the domains that they focused on, D3, D5, and I guess D1, right? D3, D2, and D5. Yeah, D2, D3, and D5 were the ones that they focused on in there. But we're going to look at all of them. So D3, rigor of development, as I just mentioned, seems like they all did not really get like very high scores, but the one with the highest score was Decide AI again. And then for clarity of presentation, Decide AI also took the lead. And applicability, clear. So she's like one, maybe, as seemed like it was geared towards simplifying the process. So minimal requirements. And then editorial independence, they all seemingly are doing well from editorial independence point of view, where Tripod seems the most independent. Tripod and Decide. So it seems like Decide as the winner based on their assessment. Decide again, it was this one, published in Nature Medicine. It is 27 checklist items, 17 AI specific and 10 generic. It is a reporting guideline in alignment with the Equator Network's methodological framework. And it is the domain that focuses on reporting of early stage clinical evaluation of AI systems. So if you're developing an AI tool for clinical use and you want it to be clinically evaluated and you're going to publish it, then you might want to go for Decide AI as a template or a framework or a checklist to make sure that you are in line or following the guidelines for reporting your research and your methodology and your results. All right. Okay, so parallel coordinate plot of agreed to domains and guidelines. I think here they just put the scores and each line is the guideline. So let's look at Decide. Decide is in pink. that's the one here. Yeah. So, right, decide, spirit, and then consort are doing good job. Clear is on applicability. So if you're looking for a guideline that is easy to use, maybe you go for clear. And this is a scatter plot of targeted agreed to domains across guidelines. So I guess they focused on domain 2 and 3 and 5, right? Rigor development, stakeholder involvement, and applicability. These are the guidelines here, and this is the score for each domain. So applicability, if I mean it could show that there is some correlation going on between the scores or anything, but I don't see any pattern. Like, I don't know if why is this important to show? Okay, is there like a reason for why is this small, why is this bigger? I'm not sure. It would be interesting to read more about or have better description. Of this plot, so the reader could understand it. I don't know. Maybe if you could tell me more about it, if you're seeing this, please feel free to comment and tell me what do you understand from this plot. Okay, so yeah, that is pretty much it, and here is the discussion, and then they finish with this figure, which is identified elements of transparency, reproducibility, and ethics in medical AI research. I don't know if that relates to the FAIR principles we talked about a little bit earlier in the beginning of the presentation. So there are transparent, reproducible, ethical. So the medical AI research should be transparent, reproducible, ethical, and these are the elements that gets us there. So to have from transparent, you have standardized, detailed reporting, and those are the guidelines that you could use. And you include state domain expert in the development. It's explainable, interpretable, and there is a possibility of algorithmic audit. So you go and audit the algorithm itself. Ethical in terms of secure, safe, trustworthy, fair, human autonomy, accountable, and then reproducible. So detailed documentation of what hardware were used, software, algorithms, architecture, frameworks, dependencies, environment, pre-processing, hyperparameters, pipelines, and seeds, version control and open source code, experimental tracking, and fair data and code sharing. So the fair is, I guess, findability. What is it? Let's look at it again. So what was fair? And interoperability, or was it? Yeah, right. Findability, accessibility, interoperability, and reusability of data and models. So that is the last figure from this paper, and it ends up with a conclusion. Before we finish, I would like to find the decide framework that to look at it as a paper, if we can, if it's accessible or not. So Baptista, is the one. And so it was published in May 2022, and it is a consensus statement with the title Reporting Guideline for Early Stage Clinical Evaluation of Decision Support Systems Driven by Artificial Intelligence. Decide. And it explains how they came up with a guideline, and you can download the checklist. So it was like 17 AI items and 10 generic, right? So it mentions, for example, the title, and it recommends how you could formulate your title. Then the abstract tells you what to include in the abstract. Then the introduction, what to include in the introduction, the methods, and when you're describing the AI system, for example, your participants, the implementation, the outcome, safety and errors, human factors, analysis, ethics, patient involvement, then the results. So if you go through it systematically while you're writing your paper or reporting your results, then you have you're on solid ground, and probably it will make it easier for you, specifically if the journal is asking you to follow a specific guideline. For example, you could relate, or you could use the Decide AI checklist. So based on this preprint, it seems like it was the best one for early clinical evaluation. Right. So is there any limitations that they want us to know about? Okay, before we conclude. So the limitation that agree to for non-clinical guidelines. So this agree to apparently is for clinical guidelines, but they adapted it for non-clinical, which is AI. They only included English studies. Right. So I guess that's a nice preprint. Probably with the peer reviewing will get better, but it is a great start, and I wish them good luck. So that was the preprint. So I hope you learned something from it. I learned. So thank you for joining me on this learning 30 minutes. So before I conclude, I'd like to invite you to give feedback. Tell me what you think, what you've learned, how can we make it better. Also, please feel free to suggest topics, other papers, and resources so we can include in the Notion page, that it becomes like a source for data, for source of references, interesting talks, interesting learning resources. And then finally, feel free to join us on Substack so you can receive updates, news, events, and new videos. So the idea is to build a community. Everyone is more than welcome, from all different backgrounds, from all different levels. Whoever is interested in medical clinical AI, please join us. And we see how it's going to transpire and develop. There is this latest post on Substack, so it has the videos that you can watch and learn a little bit about the AI basics. So thank you for joining me today for this discussion and for this presentation, and See you in the next ones.